The initial diagnosis was in about 2004, I think. And it was a result of, I had a chest infection and went to have some blood tests. And the doctor phoned me up fairly quickly after that and said, look, we found some irregularities with your blood. And we think it's probably something related to a myeloproliferative disorder. There was a high red blood cell count. And I hadn't really thought about any particular symptoms up until then, but over that period of time, I don't know, how long I'd had the condition, but I always had quite a ruddy complexion, so I got, they call it rosacea. So I had that symptom at the time, and I used to get quite tired, so they were the two symptoms that then I was able to make sense of and put down to this blood condition. No, I wasn't prepared for it, and I was quite shocked, and my reaction was to go to the internet. I'm quite alarmed, as I think people very often are looking at things on the internet. The descriptions can be over dramatized of these things and so on and so forth. So I thought that was curtains. I thought that was, I thought I got what I remember reading, that it was an incurable disease, a blood disease, which would lead to leukemia or onto more complicated myeloproliferative disorders and so forth. So I thought it was only a matter of time, and I was given a sentence, really. So yeah, I was alarmed at first, but then talking to the consultant who I've stayed in touch with and who's under whose care I am now, Claire Harrison at Guy's and St Thomas's, she kind of put my mind at rest and put it into some perspective. She said, yeah, what you've read is right, but we do have ways of managing this, and what we're going to be looking at is finding the right kind of therapy, the right kind of regime to manage the disorder. And as long as it's kept in check and monitored carefully, I should be all right and be able to continue living. Yeah, my wife was obviously worried. I mean, as anybody would be, if if your partner, your husband or wife is diagnosed with what we understood to be a terminal disease. That's how I thought it was, what it thought it was at the time. So she was just as alarmed as I was. My kids have always, they were 14 and 15 at the time. They've always, been aware that I've got this condition. I didn't feel any need to kind of hide it from them. And, they remained aware of it and see it in the same way I do now, really. So yeah, initially we were all alarmed, and then it was put into a perspective and it's just something that I've learned to live with. I mean, I had it since 2004, so it's a part of my situation, really. Around 2012, 2013, this MAJIC trial came online, and would I be interested in it? And I just said yes immediately. I obviously discussed it with her, and she explained the difference and so forth. She said it was a really important development, and they went on to the trial, and it turned out I was number 001, and which tickled me at the time. But it was so I was the first person on the trial, and that drug worked immediately. It started to bring everything into line. My health improved, the rosacea in my face went, I stopped itching, I had energy again. I got my life back, really. Yeah, it was very good. There was no hiccups. I just kind of segued into this new drug regime. There was apparently no side effects. 7 years now, and I couldn't identify a negative side effect. So I was on the trial for 5 years. The trial finished, and then Claire, my consultant, negotiated that I could continue getting access to the drug directly from the drug company, and that's where I am now, 7 years later, still taking the same dose of the drug, and touch wood, fairly, it's working. It continues to work. Amazing pills. I mean, it's what amounts to, as I see it, kind of genetic modification. It's amazing that you know, a drug can do that, but it targets the red blood cells, you know, suppresses the cellular reproduction, but in a very targeted way. It's remarkable, you know, it's beyond me really, but that's, you know, I think it's a kind of a miracle as a non-scientist. It would have been a lot bleaker, I think, hence my decision very quickly to go for this. I was thinking, oh my God, how lucky I am to have got this drug for me, when I could see more people than I imagined weren't responding to the therapies that they had, and were getting quite ill, really, you know. Yeah, the nurses are just amazing. Yes, I can remember every single one of them. They become friends. They're amazing. They're amazing. They're dedicated. They're knowledgeable. Work absolutely as a team of equals with the consultants and registrars. They're treated with a lot of respect in the unit, certainly that I've been to, and every single one of them have been extraordinary human beings. It's absolutely fundamentally necessary for as much energy to be put into trialing new therapies. I wouldn't have got this treatment. The level of care that I've had, the kind of engagement of these people in finding solutions to these diseases, just wouldn't have happened at anywhere, I'd imagine, at all, if at all, anywhere near the same pace that it's happened over the period of time I've been involved in you know, a patient in it. I've been really happy to have been of some value back to the people that have been supporting me and caring for me over the period of time. So I was very happy to do that. I'm very happy that the team there are pleased to have me and call on me to talk to people like yourselves about my situation. Very happy that I'm called on by the team of clinicians, etc., consultants, to talk to other people and share my experience with them. So I'm pleased to be able to give at least a little back in terms of the support that I've been given. I would say to anybody, go to the groups, use whatever facilities there are to be able to talk to people who've had this condition. Find out as much as you can firsthand, with, you know, in conversation with people, to see what's possible, what's available, and what, you know, and to see what good's being done.